I am Alicia Luckie. I am from the South. I guess you could tell that. I reign from LA, also known as Lower Alabama. But happy to be in South Carolina and to be here today to talk about protective factors and how we can build stronger communities and families here in South Carolina. As we get started today, I just wanted to say, look on your tables. I'm not sure who brought the pinwheels, but if you're not aware, this is National Child Abuse Prevention Month, and the pinwheels are a national symbol that shows the prevention movement, and so we're happy to have those here. I've heard that you can see them all across the state in many different venues, so if you see those out, you'll know what those stand for, and I'm glad to see those here today. So I'm with the Friends National Resource Center, and very similar to Teresa's Resource Center, we are funded by the Administration on Children, Youth, and Families through the Children's Bureau, but we are specific to the community-based child abuse prevention agencies in each of the states. And here in South Carolina, that is the Children's Trust. So we are also part of CAPTA. We are in CAPTA Title II. So we are here to provide any type of training and technical assistance to the state lead agencies around prevention of child maltreatment. So as you heard Lillian talk earlier today, some of the information I'm going to share really is a shift. It's taken from that primary and secondary prevention effort, and it's really kind of shifting the focus of where CPS had been on one side to really looking at more that preventative side of things and how we can meet families where they're at and serve families better. So just a little bit of information. This is information I'm sure all of you know, but I think it's good to kind of set the stage for kind of where we are and then how protective factors came about and how then we can begin to implement them into the work that we're doing. So as we know, child maltreatment, abuse and neglect occurs across many families. There is no specific way we can pinpoint a specific family in a specific place that's going to abuse or neglect their children. It occurs across all socioeconomic, religious families. There is also no single cause for child maltreatment. We know there are lots of things out there that can increase the risk of a family maltreating a child, but there's no particular thing we can pinpoint. When we look at the most recent child maltreatment data, we see that there is a huge need for prevention across the country. So in 2011, there were 3.4 million referrals of children being abused or neglected, and that totaled 6.2 million children in our country that are affected by abuse and neglect every year. We also know that more than 2 million reports were screened in and had a CPS response and received an actual disposition. So that is kind of the equivalent of about 27.4 per 1,000 children in our country. So if we had a room of 1,000 children, 27 of those children in that room would have had a possible report of child maltreatment or neglect. And so we know that CPS estimated that over 600,000 children were actual victims of child maltreatment. And as you can see too, the breakdown is a high area of neglect and around physical abuse and then sexual abuse. So we know there's this huge need for prevention in our states, in our country, in our local communities. The data tells us that. We also know through research that there is a number of risk factors that families have. And you all, being familiar and working with families, know these risk factors well. So there is a combination of individual, community, societal factors that can contribute to child maltreatment. But as you see in the framework that I'm going to talk about, it's important to know the information about risk factors. But it's also important to know that there's some things we can do to help mitigate and buffer these risk factors in families. So when we look at a family or we run across a family that has these risk factors for child maltreatment, there is something we can do so they won't maltreat or neglect their children. So the risk factors we can look at that we're familiar with, maybe individual factors related to parents, related to specific needs of their children. So we know we have families, Teresa was talking about some of those families, that they may have substance abuse, mental health issues, they may have domestic violence issues. These are some things that the individual parent may be dealing with. That could be a risk factor for child maltreatment. We also know that for an individual child within a family, there can be risk factors. We could have a child with a special need. We could have children that have difficult dispositions. They may have emotional issues. Those things create environments that can increase child maltreatment. We also know that family issues can cause that. If you have a loss of a job, or loss of housing, any type of condition like that, a death in the family, anything like that can cause, an increase in those risks, as well as community. If things are happening in the community, you don't have a safe community, that can also increase those risks. So we're real familiar and we're really comfortable about talking about how many children are maltreated, what are all the risks involved in these families. Some positive things we know about children that we need to focus on. So we're kind of now shifting our frame. We're kind of going from the side of always focusing on what are the risks, what are the deficits in families, to really thinking about families in a more positive way. So what are some of the things we do know about children that we need to think about? We know that the first 5 years are intense years of child development. We know those are the most important years that children's brains grow and develop. We also know that the physical and motor actions and connections that are happening to children at that point in time in their lives are the most important times. So why is this important? So when we look at all these important pieces of social development that happens at that age, for connecting with parents and caregivers, what do we see happening? Well, what we see here, let me go back, is age-specific developmental tasks are happening, individual variations within children, hereditary is important things to consider, their social environments. So all these things go along with that child developing over time. And so what do we know about parents is that when families gain this information about children, then they have what they need to be successful with these protective factors in their lives. So we know if we build up the factors around helping parents know knowledge of child development, helping parents bond with their children, helping parents provide the right services for themselves and their children, we know that they then gain the positive things they need to be successful in their lives and communities. So the importance of relationships. As we know, caregivers are the first and most important sculptors of their children's brains. We also know that the environment that a family and a child are in helps to shape the way that child develops too. And we also know that the importance of emotional and empathetic response in between those parents and children and the caregivers and children at a young age is very important, not only for that child to be successful at a young age and be successful in school, but also to be successful as an adult and later in life. There is some research out that many of you may have heard about through the ACEs study, and where it looks at traumatic stress. And we know that a lot of the families that we're dealing with, whether it be through CPS or through the appropriate response, are some of these families that have had traumatic stress in their lives. So it may be a specific traumatic event that happened. And what happens is this kind of alarm or a bell goes off and creates this stress response. And in families that have this traumatic event happening, what happens is those connections that we were talking about that the children are supposed to have happening because they're supposed to have these loving, nurturing relationships at a young age, this traumatic stress happens and it causes other things to happen. Those connections don't form the way they should. So it's important for us to know not only how to deal with those traumatic issues, but then how to support the families to help those children. Here's just a little bit of information about the Adverse Childhood Experiences Study. It's also called the ACE study. And it really looked at the relationship between a current adult's health status, child maltreatment, and family dysfunction. And as you can see up here are the different categories that they looked at and measured that within those adult families. And basically what they found was if a person as a child had a substantial amount of traumatic event in some of these areas. So say they had 4 or more of these things happen in their lives. They then saw later in life they had a lot of health issues, a lot of different factors started coming out later in life that other people that did not have these traumatic events didn't have. So there is a lot of work being done now around how do we help support these families. And protective factors is one of the ways we can help do this. If you would like more information specifically about the study, it can be found at the Center for Disease Control. They have a great website with lots of great information. I would definitely recommend you go there and learn more about the work that they're doing around that. So why is all this information important? So you're sitting there thinking, why do I need to know that early brain development is important with children and families? And why do I need to know that children don't develop the right way if they've got this traumatic event? Well, one of the main reasons is because children under 5 are the fastest growing child welfare population. And so if we think about they're the largest number of children coming into our system, then guess what? It's important that we know how children develop. It's important that we understand how important those first relationships are with them. And if we as the providers know that, then when we're working with families, we'll know how important it is that they get good quality care, that they have good caregivers, that they have their healthy parents there to take care of the children, because those connections are so important to make them into healthy adults as they go along. We also know that children 0 to 1 are most likely to die from abuse or neglect. They are 20% of the child welfare population. So we know we need to be talking about safe sleep environments, the importance of parents having safe places for children to play and learn and develop. And so we won't have any children at all dying. We also know that childhood trauma can have this cascading impact on the ongoing development. Again, go back, look at the ACEs study, look and see what some of the children that have had those traumatic events as adults now, all the different things that are happening because of those traumatic events. And we also know that young children are among the most vulnerable at having lower levels of attachment skills, social and emotional competency, self-assurance, confidence, and independence. So it's really important that we help families learn how to build those within their children. Just a little bit about the research and what it indicates. So back in 2001, the Center for the Study of Social Policy was approached by the Doris Duke Foundation, and they said, we're interested in finding a way to reduce child abuse and neglect, but we want to do it everywhere. We want to find this way we can take a message out that we can really reduce child abuse and neglect in a meaningful way. So the Center for the Study of Social Policy began to look at the research and the literature. And what they found was there are some things in families that can buffer those risk factors. And because we know risk is not an actual prediction that abuse will happen, but it's just kind of a red flag that something's going on there, or that maybe they need a little extra support or a little extra help. So they looked at all the research and came up with 5 specific protective factors that are tied to child abuse and neglect, building strong families, and ultimately provide for optimal child development. And the good thing about it was you could build these protective factors in many different ways. Now, what I will say is, in the beginning, when they were looking at this approach of building protective factors with families, they were truly looking at it through a primary prevention lens. And so they started with the early childhood community, and they went to several different innovators across the country and asked them, how are you doing this work? How are you making this work with your families? And they came up with all these great things they were doing. Well, come to find out, they matched up to these 5 protective factors that were happening. So they had strong supports in the communities. They had knowledge of parenting and child development. They were within a child care setting. They were connecting and linking parents. They were linking them to resources. They were doing all these great things to support families within the community. It wasn't about they had been referred to CPS and they were being provided all these services. They were actually seeing success from parents because they were building relationships with them and they were helping them get the services they need. But what we're also now seeing to kind of happen across the country over the past 11 or 12 years is this framework is now showing up everywhere. So we're seeing it in home visiting programs. We're seeing it in school systems. We're seeing it within communities. We're now seeing it across child welfare. We're seeing all of these other systems realize, and the way I always say it is, it's what we've always known was right to do with families. It's what we all know, like Teresa was saying. I know my husband's a great support, but it's almost putting kind of words to things we know, and the research actually supporting the things we've always known were good for families. So therefore, why is it important to look at it for children within the child welfare system? Because we know that when you're involved in the system, that there is a particular focus on their developmental needs. As Teresa spoke about, there's a national movement at the federal level to really push states not only towards the safety of families, but really towards building child well-being. So not only when a child comes into the system do we want them to be safe and get the services that they need, but we also want them to be better off, right? We don't want them to come into the system and leave and just be safe. We want them to be better than when they came into the system. And so that's why building this framework around protective factors helps us to hopefully improve child well-being. So when people leave the system, they are truly better off. Developmental supports for the children must also be informed and understand the impact of the trauma on development. I think this is a huge piece, again, goes back to the ACEs study that we're talking a lot about is we are now realizing these traumatic events and the impact that they have had on families and really around the child's development. And we really, as providers, need to be really cognizant of that, understand that research, and especially when we're working with families. And then we must also be intentional. And I must commend South Carolina. I really have to, for moving you all forward with this. I think there are 5 other states that have started looking at integrating protective factors into their appropriate response systems, their differential response systems. Y'all are one of the leaders in this. I know it's new to folks. I know it's something that may seem shifting kind of your traditional way of doing business, but I must say it is a good way to do business. It's really making partnerships with families and really working to build healthy children and families in South Carolina. So I just really commend y'all for the work you're doing here. I think it's fabulous. So the Strengthening Families approach is not about doing a whole new way of business. It truly is about making small changes in everyday practice, building relationships with families so you can help build strengths within those families, and really about promoting those better outcomes for those families. So I'm not here to tell you you've got to adopt this whole new way of doing business. It's really about just shifting the way you think about doing business and really maybe looking at it through a different lens. And there's some great strategies to help you do that too. So I'm not going to leave you here without giving you some of that great information you can go back and do. It also builds on existing strategies and systems. I'm not coming in here to create a new alternative response system. I'm saying here's some great tools you can use along with your system that can help move outcomes along. And we also know it's grounded in research, practice, and implementation knowledge from multiple fields. Again, we're linking a lot of people together that probably haven't been linked to child protection before. We may be bringing in early childhood education. We may be bringing in the prevention providers. We may be bringing in home visitation. But we're really looking at serving families in a new way. Y'all probably can't read this, but it is... There it is. The Strengthening Families approach, and what you see on the left-hand side are kind of the levers for change. So we know that parent partnerships are important. We know that policy and systems changes are important. Guess what? Y'all's policy and system change are already moving this way. When Lillian got up here to talk about it this morning, I think she was really clear that she's really wanting to see this shift happen across the state. I think they've already done a lot of training around the protective factors. And so it's now bringing it out to the community, bringing it out to the state. And just like today, professional development opportunities, providing the opportunity for you all to get together to develop your knowledge around this. Then you see there's some strategies. The strategies are there because it helps you know what are some ways we can, as providers in the communities, partner with families. And it's things that you've already done. Facilitating friendships and mutual support. You heard Teresa talk about the importance of the parent relationship. It's about strengthening parenting, responding to families in crisis, linking them to appropriate services, valuing and supporting the parents. Don't go in and tell the parents what they need, but working with the parent and letting the parents decide what it is that their family needs. It's also looking at that child's development. How do you further support the family to support the child's development? And then, of course, by all means, we're all mandated reporters. If you observe and respond to those responses early on, hopefully they won't go into that CPS system. And we do that through the protective factors, which I'm about to talk about, more specifics. And then ultimately, we get those positive results for children and families. We have stronger families, children have great optimal development, and in turn, we reduce child abuse and neglect. Okay, so a little bit about the protective factors. I don't know if many of y'all in your packets, I know you have about a 6-page handout that the Center for the Study of Social Policy put together, specific information on each of the 5 factors. I will not go through that, but it's in your packet. It is a wonderful resource. Take it back with you, read it. It's got some great strategies, great information. Also, I saw out on the table a few of the 2013 resource guides, and it's Preventing Child Maltreatment and Promoting Well-Being. In this guide that you'll find out there, if you can't pick one up, you can download it off the Child Welfare Information Gateway site. It's childwelfare.gov, and this is their national Child Maltreatment Guidebook. In it is all the information about protective factors. It also has great calendars, and it has super handouts for parents in English and Spanish. So if you don't have one of these, get one. It's absolutely wonderful. So protective factors, these are factors that can protect families and promote resiliency. Again, I was saying they provide this buffer against adversity within families and the likelihood that child maltreatment then goes down. So we are less likely to see families coming into the system because of this. It also is a framework that focuses on prevention and building strengths rather than the deficits. Like I was saying earlier, really, really important that we know those risks, because we do need to know how to identify families that may be at low or moderate risk in our communities. But the framework kind of shifts us to not look at families only in a deficit approach, but to help them build and promote these protective factors within their families. So what is it all about? It's about you guys. It's about mobilizing partners, communities, and families together to build their strengths, promote optimal development, and ultimately reduce child abuse and neglect. That's what it's all about. It's all about you. So here are the 5 protective factors. The first is knowledge of parenting and child and youth development, parental resilience, social connections, concrete supports, social and emotional competency of children. And within social and emotional competency of children, we also look at the importance of nurturing and attachment. And I'm going to go into a little bit of detail about all of them. I know we don't have a tremendous amount of time today, but I did want to make sure you have your resources. You can go back and read more details about each of them. But knowledge of parenting and child and youth development is really just the basics of understanding and utilizing that effective management techniques for age-appropriate expectations. So, for example, if a parent knows that it's completely normal for a 2-year-old to throw down a temper tantrum in Walmart and not think that the child is doing it on purpose, those are important things to know. It's an important way, as a parent, it's important to know, okay, I'm just going to walk away over here for a few minutes, still keep my eye out on that 2-year-old in the floor, make sure they're okay, but not acknowledge it. Those are important skills that parents know, because in that way we don't get frustrated. So what we do know, the normal range of developmental activities. What's supposed to be happening with my 3-year-old? Are they supposed to be going to the bathroom on their own? Maybe they're not yet. Those are important things to understand. It's also important to understand discipline techniques. What you need to know to discipline a 3-year-old and what you need to know to discipline a 16-year-old are very different, but very important. Here are some just examples of some things you can do. When we talk about parental resiliency, we're talking about the ability to bounce back from something. So having those adaptive skills and strategies in times of crisis. And many of your families probably will be in times of crisis when you see them. But it's about that family's ability to be able to open up, to share about those experiences, and to overcome them. So, you happen to be in a family and the parent has lost a job. Maybe they need some extra resources or extra help that month. Maybe their car has broken down. Well, if they don't know who to go to, where to get help, this could, potentially turn into a very serious situation. So being able to have that internal parental resiliency and bounce back from things that happen in their lives is so important. We know that hope and optimism goes up in families that have parental resiliency. We also know that they have really good problem-solving skills. They come up with creative ways to handle situations. We also know that they are really good at maintaining and being calm. So they have good anger management skills. They are also help-seeking and future-oriented. So they have this vision of hope out there. They don't think that just because my car broke down today, oh my God, it's the end of the world. I'm just not going to make it now. I just don't know what I'm going to do. But no, they actually can see past that. They actually have that future orientation. That's being resilient. It's being able to overcome those obstacles that we all have. Social connections. We also know that families need social connections. As a parent or a child or youth out there, we know how important family members are. We know how important it is to have friends, to have connections within the community, whether it be faith-based or schools or peers. All those different things are important to have within our lives. And the reason they're important is because we know they provide, hopefully, positive emotional support. We hope those teenagers out there aren't getting involved with the wrong crowd. It happens from time to time, but we're hoping the supports and the things that people are choosing to do are positive, that they're providing a positive emotional support to those families. And they're providing positive parenting norms. I mean, how many of y'all in this room can say, as parents, a lot of times something was going wrong and you would call up mom or you would call up your sister or you would call up your best friend and you would say, oh my gosh, my child is driving me crazy. What do I do? Well, it's those kind of positive social connections that help us as families. And then just the fact of having that mutual resource and sharing to help, to support each other. And through this new system that you're developing in South Carolina, truly the case management, the shift in the way you're going to be working with families is more of a helpful role. You're wanting to not be so punitive, but really be seeing it in a positive way. So it's about connecting people to other people in positive ways, helping them to build those positive social connections. Also, we know that in times of need, sometimes we need concrete support. So we need to have access to those tangible goods and services that can then help us get through whatever it is. So whether it be food, housing, clothing, all those concrete services that we know families need. Sometimes families just don't know how to access the services, and it's up to us as the providers to let them know how they can get access to those services. And it's important that we have a system in place that can help support that as well. So all of those things we can do to help build those concrete supports. And then lastly, we're going to talk about the social and emotional competency of children. And again, this is important because this is where we focus, all of the other factors kind of focus on the parent and their responsibility as the parent for taking care of the children, for taking care of the family, for taking care of themselves. But this particular one focuses on the child specifically. And we're really looking at building those social and emotional connections within the child. How do children learn to regulate their emotions? How are they engaging with each other and communicating their feelings? One of the pieces of this work, and it's not specifically spelled out as one of the 5 protective factors, but it certainly is a protective factor, is around nurturing and attachment. And what we know around nurturing and attachment is when you have a baby, the importance of that parent and child bonding together and how important that is later in life. So not only do we start at the point of nurturing and attachment, but then we teach that child how to manage and work with others as they grow up and they get older. It's important to start integrating that type of information into our early childhood system, into our school systems, and just across multiple systems of building that time. One of the things too is that we know if you build good relationships early on, through the parent and the child. And in some cases, it's important because parents may get depressed, they may be unable to bond with their children, and it's important they get services so that they can then be able to bond, because what we know is later in life, this is important for the child to be able to develop their own relationships, peer relationships, relationships with teachers, with when they go to work, then how to handle relationships in a working environment. So we know those are foundational things that need to happen within our families. So kind of then that's the framework around the protective factors. We are leaving you some great information of what you can go back and do. When you go back and you think about the protective factors, I want you to think about what is it that you can do in your communities, in your place of business, to start thinking about how can we shift our focus? How can we really start to look at families in a different way? So we want to ensure that children in appropriate response are connected to the appropriate supports. We want to make sure that we are building the protective factors within parents, whether they're birth parents, foster parents, adoptive parents, but that they themselves were helping to build those. And then we want to respect parents. We really want to build a partnership with parents. And so as we see this paradigm shift, one of the most important things we're going to be looking at is around partnering with parents. And I think this is the key to making the protective factors framework work for you. It's really around this family value and recognizing the importance of the families that you work with. Moving away from that stigma and labeling of families of, well, you know, they're one of the families we're working with, one of the CPS families. We don't want to do that. We want to become a partnership with families. We want to reduce the distance between families and really work at it together. Building relationships with the parents is important. Relationship-based practice in child welfare is probably new. I know we've talked about it in the past, the importance of looking at strengths within families, and we've shifted kind of how we've done that. But this is truly about making partnerships with families, about doing an alliance, a really shift in power. We're not coming in as the Child Protection Agency telling you what to do, but we're coming in as a partner to work along with you to find out what strengths you need to do. How do we help you build these protective factors in your families? Parents are consciously building protective factors in their families. Just like we were saying today, you can all sit here and think about your own families and look at those 5 areas and tell me all the things you do that keep you strong. That's the reason you have those protective factors in your families. I can do it. I could sit up here and tell you, you could too. So we are always building those protective factors. It's about changing the shift of just the staff thinking about working with families in that framework. Just making a conscious effort to maybe reframe how you do an assessment, maybe reframe how you do a follow-up, maybe reframe how you engage with the family. So it's thinking about just doing things a little bit differently. Here are some of the strategies that you can do. Adopting decision-making tools and processes that includes parents as partners. Making it a team approach. When we work with families, we do it together. It's not me as the worker coming in, but it's about us sitting down with that family to decide what's best for that family. Collaborating with others who have partnerships with parents. So maybe it's other community partners. Maybe it's like Teresa said, maybe it's the faith-based community. I know in my community in Alabama, being from the South, we have churches on every street corner, and we have volunteers in our church. Let me tell you, they are willing to do what they can to build a strong community. They are a great resource. Protective factors-based parent and community cafes. How many of y'all have any of y'all been to a parent or a community cafe around protective factors? Okay, I see a couple of hands. Great way to build community support around protective factors. Also providing training. I know the Children's Trust does training around protective factors, around building parent leadership. I know there is a movement here around building parent leadership and what that can be involved in. And then also parent-led advisory groups. So really making parents have a voice, not only in our partnerships with them, but even at the state level. How can they help inform the system? How can they be here today and helping us inform the work that we do? The Center for the Study of Social Policy is looking at applying this framework across child welfare. And again, it's very new to child welfare. It's something they're just getting into. But when we think about the appropriate response system, we're looking at the first few areas of the child welfare continuum. So we're not necessarily looking at in-home care, out-of-home care, or permanency. But we're really looking at the family up front. And so what I wanted to look at, did I skip one? Yep, hold on. Okay, was around intake and investigation. So when you're doing intakes and investigations, and this is not only, this probably falls to some of the state level people in the room too, but to really think about assessing not just around risk, but then looking at the families around protective factors. So it's a way we can shift how we do our assessments of families. We can also use this framework to help inform planning around differential response or other response activities, which is what we're here doing today. We're giving you a framework that can help you improve the work you're doing with your differential response system, and to ensure that developmental progress is assessed as part of early assessments. So ensuring we do it early on. So not waiting until the family gets to a point where they can't have, they have to go to CPS, but that we catch them early enough on to provide that. Again, here's some ideas around case planning, that you can include specific objectives around protective factors within case plans. So around those 5 protective factors, how can we build case plans for families in looking at that framework? How can we develop planning tools that include orientation around those the protective factors? How can we engage partners? And how can we look at other systems, such as the courts, judges, attorneys, so they know when the family comes into the courtroom, they're actually looking at the 5 protective factors and planning around how do we support those families around those 5 areas. Also, the importance of the professional development system. All of you here today are trying to understand the importance of developmental stages, the importance of how do we align the protective factors with the work that we do, how do we align that with trauma-informed care. So creating opportunities like this today where we bring different people together to talk about this, that's what it's all about. And then lastly, employing a community approach to child welfare. Again, we talked about the importance of the community cafes. We talk about community planning. So when you go back to your communities, I want you to take the information you get here today, and you probably have a group. I want you to go back and share it. Come up with a plan of what you're going to go back and who you're going to talk to and who you're going to meet with and what you're going to do. That's what it's all about you taking it back to your communities and you making it happen. And then building the collaboration among all the service providers, because truly it is you, the service providers, that are going to be able to make the shift to bring this back to the families and to change the way you've been doing business. In closing, there is a great resource through the Children's Trust, the National Alliance of Children's Trust and Prevention Funds. It's called Bringing the Protective Factors Framework to Life in Your Work. It is a free online training you can take. It is a little lengthy. It's 7 courses, and it takes approximately, it doesn't really quite take 2 hours to do it. I've actually been through it, helped planning it. It's a great course. It provides great strategies, great information, and you also get CEU credits for it. Great resource. We'll make sure that you have access to the slides so you can get that information. Friends, the organization I'm with, the National Resource Center, also has an online learning course around the protective factors. It's much shorter. It only takes about an hour to go through the module, and it provides you kind of the basics of the protective factors, very similar to what I quickly went through today, but provides a little more information about how you can integrate those and work with families. And then lastly, I just wanted to share about the federal partners. Bringing this information to you today is not just about what's happening here. It's about what's happening everywhere. And this list up here are all the federal partners that are involved in this work. So not only is it happening right now here in South Carolina, but it's happening everywhere all across the country. And these are all the different partners, from the military to the health, to child welfare, to early childhood. Everyone's talking about protective factors. How can we work with families? How can we really prevent abuse and neglect from occurring and build healthy families? And lastly, as Teresa shared a map of implementing states that were doing alternative response, here is one related to the Strengthening Families movement. And as you can see, there is only the dark colored states are the ones that are doing something related to protective factors. The lighter ones are ones that are not actively, but I can tell you in those states, because I work with 3 or 4 of those states, they are doing stuff around protective factors. They are looking at it. It may not be a movement or something specifically out there, but states truly are adopting this different way of focusing and working with families. My contact information, and then our National Resource Center has some great information at friendsnrc.org. If you're interested in information about child abuse prevention, we have some great resources there to you have as well.